So in those examples where clients have actually utilized multiple programs at once and possibly have seen some ROI come in, can you share a few examples of the types of clients or how many patients they've enrolled and what outcomes or ROI value benefits that they've seen?
Yeah, in working with Panda Health, your clients are health systems, so I'll put that in perspective just from a health system point of view. Is we've been involved in a lot of integration projects, but also a lot of we're using this EMR in our health system, and now we're moving to a different one, and those can be a little bit more complex as well. And what we've seen is if we do it the right way from the start, from an implementation standpoint, and make sure that the right people are working with us for that launch, we're much more successful. So having someone from billing, having that integration team part of the launch from the start, along with a site managers, outpatient center managers, and also clinicians to sign off on protocols. So in the specific case of a large health system in Memphis, we've gone from their transition from one EMR to the other. They had different EMR in the outpatient centers, and then another EMR in the inpatient in the hospitals, and then working on that conversion to one connecting dots. Then we're able to then launch an enrollment campaign for their eligible patients that want to opt in. And then we're also able to, at the same time, to implement a transitional care management program for discharges. So now we're propping up the program and enrollments in two different fashions from two different quote unquote pipelines that are going to make the program successful. And in those cases, we're usually able to enroll, our averages around 30 to 35% of patients that are eligible that come through, we're able to enroll. And then that education on site can prop that up another 10 to 15% if we have people enrolling patients during their visits at the outpatient clinics, and also have people helping to enroll during transitional care management and discussions with the patient post-discharge. So having those two streams has been key for us to have results within health systems. We're helping connect the dots within the system, and then we're also working on two different programs, one that's looked at more for fee-for-service in the outpatient centers, and helping facilitate one that's more value-based within the health system. It's through the inpatient centers themselves.
Yeah, that's fantastic that you offer that flexibility and are able to work across different situations within health systems.